Hi, I'm contestant number 8585 and I'm competing in practical nursing. I have entered my patient's room to discover that they are not responding appropriately as they normally should. I have come to the determination that they have had a possible stroke. However, I should always keep in mind when assessing the scene of any suspected stroke that my on-scene time should be as short as possible, considering that a stroke is something that is life-threatening. A stroke happens when part of your brain isn't getting enough blood as it typically should. This commonly happens due to a blocked artery or simply just bleeding in the brain. Without that steady blood supply, the brain cells in that area can begin to die due to the lack of oxygen that it's not receiving. The signs and symptoms of a stroke can include weakness or numbness, the inability to speak or to even understand comments, a sudden or intense headache, blurred or a loss of vision, dizziness or loss of coordination, a severe headache or even a seizure, nausea or vomiting. It could be one-sided paralysis, pulse and respiration increases, an elevated temperature, or hypertension, which is a rise in blood pressure. It is important to keep in mind that there are more than just one type of stroke. There are two main strokes that we will be going over. The first one being the ischemic stroke. These strokes are caused by blockage in an artery. In very rare cases, this can be due to a vein. That makes up about 87% of strokes. The other 13% of strokes are hemorrhagic strokes, and these strokes are simply caused by bleeding. Hey, are you okay? Are you okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5. After I assess the scene and dial 911, I continue to do compressions until emergency services arrive. It is always important to remember that when you are dealing with a patient to remember appropriate PPE, which stands for personal protective equipment, which includes performing hand hygiene, as well as sanitizing, wearing a gown, applying a mask, using eye protection, applying gloves, and lastly a PPE check to make sure that you have all the proper steps needed and to not only reassure your own safety, but as well your patients. Throughout this clip, you can see I am performing the proper hand hygiene to ensure the safety not only for me, but for my patients. In this clip, you can see that I am thoroughly washing my hands to make sure I get every surface possible. Now that we've done effective hand washing, we want to make sure to put on the proper size gloves so that we can work to the best of our abilities. A part of proper hand hygiene is also hand sanitizing our hands. Once you've applied the sanitizer, you want to make sure you continue rubbing your hands until dry. Hi, I'm here to take your vital signs, and then once we're all done with that, I will go ahead and distribute your medication. And then once we're all done with that, I will go ahead and be referring you to the front office. Vital signs include height and weight, which was done prior to me entering this room. We are now going to go ahead and do blood pressure, temperature, and the O2. You also want to make sure that you change your gloves in between each patient, which I did prior to this. We're going to go ahead and take the adult cuff and come wrap it on our patient. After assisting the patient to lift up their sleeve, we are now going to go ahead and apply the cuff. It's important to remember that when you are wrapping the cuff around the patient to have it as tight as possible for the best results. When taking your patient's blood pressure after a stroke, it is important to remember that it should only be about 140 to 160. However, that's only for the first 24 to 48 hours. A blood pressure above 130/80 increases a risk of another stroke. So if your patient has that blood pressure, you want to keep this in mind and do anything you can possible to prevent this stroke from happening. Or even better, just to be cautious and aware of this. It is important to keep in mind that an elevated blood pressure can cause various psychological changes. Some of the psychological changes can include the damaged blood vessels in your brain due to the stroke, or simply the bleeding in the brain. We are now going to be taking my patient's temperature. Can you open your mouth wide for me, please?
My cousin's friend. I saw him literally right before I walked out.
Now that we've gotten my patient's temperature, we're going to go ahead and dispose of this and write it down in the chart. We're now going to go ahead and take my patient's pulse. You want to keep in head that when taking a pulse, you should take it for 30 seconds and go ahead and multiply that number by 2. We're now going to be taking my patient's O2. Can I have your finger, please?
I have a lunch meeting, but after that, what are you guys going to do? Here? Okay, let me know if it's different.
Now that we've got my patient's O2, we're going to go ahead and document that as well, and now we're all complete with the vital signs. As I gather all this info while taking my patient's vital signs, I want to go ahead and get their chart and insert this information. Now that we've taken your vital signs, we're going to go ahead and give you your medication, which is an injection. Here we have the medication, our needle that we'll be using to distribute this medication, the cotton, sanitizing wipe, and lastly our Band-Aid. First, we're going to go ahead and sanitize the area. So we're going to go ahead and lift the sleeve as already done, and we are now going to take this wipe to sanitize this forearm area. And you're going to make sure you do a circular motion starting in, working your way out. We are now going to put this to the side. As the forearm dries, we are now going to go ahead and distribute the medication. We're going to go ahead and distribute the medication up to the 1. We're going to go ahead and make sure there are no air bubbles. Make sure that the area is dry. Open it. Have it inserted and push.
Thank you for watching my medical assisting video.
Now that that's done, we're going to have our patient hold the cotton. They are now holding it. And now, as they are holding it, we're going to open the Band-Aid.
Thanks for watching. Go back again next week for another video similar like this. Except it's on CPR.
We're now going to remove this and put the Band-Aid over the wound. We have now completed our injection. Now that we are all done and completed with your vital signs as well as your medication, I'm going to go ahead and assist you to one of our medical assistants so that way they can go ahead and schedule you for an MRI. It is important that we inform our patients that the recovery after a stroke is a lifelong process and is not something that will be done overnight. However, we can always let our patients know that there are many options and ways to recover from this. Some of them being stroke rehabilitation. That includes motor skill exercises, which helps improve the muscle, re-strengthens your muscles, and it also helps your coordination throughout your entire body. There's also mobility training. The use of mobility aids like a walker, a cane, a wheelchair, or even an ankle brace can really help you gain back your strength in order to make some progress. There are even different types of therapies to help our patients improve after a stroke, such as constraint-included therapy, range of motion therapy, and even speech therapy. Some assessment tools that can be used for assessing a stroke include the 3ISS, which stands for the 3-item stroke scale, the APSS, which stands for the Australian Pre-Hospital Stroke Scale, the CPSS, which stands for the Cincinnati Pre-Hospital Stroke Scale, the LAPSS, which stands for the Los Angeles Stroke Scale, and lastly, the NIH Stroke Scale. Stroke scales are very useful in a routine clinical setting, as it not only aids to improve diagnostic accuracy, but it helps determine the appropriateness of specific treatments, and it also helps monitor a patient's neurological deficits. Not only that, but it can help us healthcare providers assess the severity of a stroke, which is very important to know before taking action and figuring out what next steps you want to take for your patient. Some diagnostic tests that may be ordered by the physician include a physical exam, such as checking your heart and your blood pressure, running blood test, a CT scan, an MRI, carotid ultrasound, a cerebral angiogram, and an echocardiogram. It is also important to keep in mind that when you are assessing any patient's mental health, to not forget history taking and general observation, as this is important to be able to compare whether they're making any progress, whether it's bad or good for the future. Yes, I have the updates that you needed on Join Doe. Some changes in their mental status that I have noticed is a short attention span, poor comprehension, forgetfulness, poor motivation as well as depression, and increased frustration levels. Yes. Okay, thank you. Now that we've let the physician know what they needed to know, we can go ahead and check our patient out.